and you sleep at home, you cannot come to school. Sivyo?
Yes.
But when we give you this one, it is vitamins. You know vitamins?
Yes.
Yes. You have heard of vitamins. Vitamin ni mzuri. Mwalimu anaandikanga hapa maneno ya vitamins. Yeah, it is found in fruits. Yeah. So we want to give you a small sweet that will protect you from diseases. Itatuzuia kutokana na magonjwa. Tumesikia watoto?
Yes.
Na kwa hivyo tukienda nyumbani tuambie mama, daktari walikuja wakatupatia dawa ya vitamin A. Inaitwaje?
Vitamin A.
Good boys and girls. So sitatakunywa sisi wote?
Yes.
Good.
The OVC program specifically is working with children to ensure that they continue having good health, amongst other things that we do with them, like education, psychosocial support, ensuring that they have good shelter and care, ensuring also they have good nutrition, and that their parents are empowered to be able to meet the needs of the children through economic empowerment. We have about 20,000 children who are under 5. And in terms of health, this is a really critical age for many under 5s because this is where their bodies are growing, they are also learning, their brains are growing, and they are forming the backbone or the background of good health in future. The biggest number is being missed out at age 12 months to 59 months. And a lot of these children at that age are, of course, beginning to walk. So they're either in daycares or in registered early development centers like nursery schools that are affiliated to primary schools or just, informal nursery schools, pre-units, and ECDs.
In the school health program, we have periodic vitamin A supplementation. That's after every 6 months. And during that time, we also incorporate deworming. We started the program because of the gaps we had. Vitamin A coverage has always been very low because vitamin A is something they should be given up to 5 years. But most parents, after 1 year, they don't bring back their children to the facility.
The only way we decided that we can target them is by taking them to schools, the vitamin A program. So when we give them, at least most of the mothers appreciate because they don't get enough time to go to the hospitals or facilities for the vitamin A.
Children at 3 years, even some as early as 2 years, are in school. In the daycare centers, at 3 years, they're in preschool. So it's better to get them in school in terms of prevention. And we know that vitamin A is very important for their bodies in terms of boosting the immunity, which has a very crucial role, at least to ensure that our children are healthy and they are in school most of the time.
Of course, the reason the vitamin A supplementation is low, is based on various factors. The first being that the population that we are working with, or the target group that we are working with, is of low income. Availability of foods that are rich in vitamin A can be a challenge in urban areas, especially whereby families are torn in between using the income that they get for health care, for food, for education, for rent. And a lot of times it's the priorities that will take precedence. So children, especially under 5s, will either end up not having enough meals. That means not having enough micronutrients or enough vitamins in their bodies, and that's why the supplementation is extremely important.
Gaining entry to the schools, we usually had resistance from the teachers, informing the parents on the importance of such activities. But once we did the training, teachers are even requesting for the services because they now understand the importance.
The school's role is extremely important because they are the ones who ensure that children regularly come to school. So with that, if an outreach is made at that particular school, then the school will be able to tell us who is available for supplementation, and those who are not reached at that particular day, then we know how many are remaining and when they can be reached again. The schools are the ones that keep the registers, of course the attendance registers for the schools. And then now we have requested them to be able to keep the vitamin A supplementation register. And they also will be reminding the health centers and the project APHIAplus on when vitamin A supplementation is due.
Documentation is a basic thing that helps to ensure that we don't repeat giving the treatment to the children. Because there's a possibility at times we might be giving, another program comes up and then they are given.
The vitamin A supplementation has been successful and has really reached to the marginalized and vulnerable who could otherwise not have gone to the facilities for it, because this role has basically been left to the caregivers. Now the school is taking the role and trying to remind these caregivers they have to do it. So it has been a success.
We are very happy and very delighted because in the whole province of Nairobi, it is only Embakasi district that has been able to carry out and train school health implementation policy.
At least I feel proud helping the children, because we could not have reached them if it were not for school health program. We could not have reached them to their homes, because most of the time their mothers are very busy, either in businesses or running up and down to look for money, at least to earn a living. So getting to the children and the concept could be really hard. At least through the school, it has acted at least as the most or the best link between the facility and how to reach the community. Because from then, we can give the children the vitamin A while they're in school, instead of going to their homes.